Hi, my name is Shonda Street and I am an MSN student at CTU. I'm going to be talking about the importance of proper PPE usage and procedure room turnover in the gastroenterology department during the COVID-19 pandemic as it relates to the QSEN safety competency. COVID-19 has forced healthcare to change the way that PPE is used and requires gastroenterology healthcare professionals to change procedural preparation. Universal precautions are standard in the delivery of care. However, current COVID-19 pandemic recommendations require additional PPE to be used to further protect the public as well as the staff. The COVID-19 pandemic has changed recommendations for the uses of PPE during procedures and during room turnaround. There has been a request that Kaiser Denver GI standardize the usage of PPE as well as the cleaning process. The American Association of Gastroenterology and the Society for Gastroenterology Nurses and Associates have recommended that individuals use PPE during every GI case as well as the cleaning procedure. This hybrid class is focused on instructing physicians, nurses, medical assistants, and housekeeping on choosing the proper PPE along with correct usage. Due to the size of the department, the format of this class is training the trainer. So between the 3 GI locations in Denver, this group of individuals will train the remainder of the nurses, physicians, and medical assistants. Objectives of this class are as follows. Learner will understand the importance of interprofessional collaboration. Learner will understand the importance of infection control. Learner will understand the method of transmission of the coronavirus. Learner will be able to provide rationales for the usage of the additional PPE. Learner will be able to verbalize why it is important not to use procedure room for 30 minutes post-procedure. Learner will be able to identify acceptable cleaning products to use in the room. And learner will be able to identify importance of wearing PPE during procedure room cleaning. The importance of interprofessional collaboration during the COVID-19 pandemic. The COVID-19 pandemic has produced challenging times, and the importance of interprofessional collaboration is evident now more than ever. Interprofessional collaboration holds the key to the successful implementation of measures that are geared at protecting patients and healthcare professionals. As the COVID-19 pandemic continues, delivery of healthcare involves the input of many different healthcare disciplines. This fact requires a coordination of care between nurses, social workers, dietary, pharmacists, laboratory staff, physicians, and other disciplines. Interprofessional collaboration can be defined as a team-based approach to the delivery of healthcare. And now a short video.
He is currently not on any nutrition, so we can maybe talk about that.
In the medical intensive care unit at the hospital of the University of Pennsylvania, physicians, nurses, the pharmacist, the respiratory therapist, residents, students, and when possible, patient and family all participate in rounds.
And so right now, every 3 minutes, we'll give another discussion.
In the simulation center at Cincinnati Children's Hospital Medical Center, physicians, fellows, and nurses from the neonatal intensive care team train together once a month.
But they're not saying that we don't have to go to ICD-10.
Yeah.
And at Community Health Center in Connecticut, the healthcare providers work in spaces called pods and use shared electronic health records to facilitate collaboration around patient care.
We know that interprofessional collaboration as a concept is really critical when it comes to keeping people healthy in this country.
Interprofessional collaboration promotes the active participation of each discipline in patient care, where all disciplines are working together and fully engaging patients and those who support them, and leadership on the team adapts based on patient needs. The Robert Wood Johnson Foundation set out to learn the most promising practices of interprofessional collaboration to help healthcare organizations provide the best care possible, to create healthier communities, and to get everyone involved in the Foundation's vision of building a culture of health. Researchers interviewed 16 healthcare organizations, then visited 7 of them to see how they developed, trained for, and modeled interprofessional collaboration. They identified 6 promising practices.
Take a listen, because this is his normal, healthy breath sounds and heart sounds.
We all went through education, many years of it, but you often did it in silos. And so then when you get out and practice, you say, well, function together. And it's like, what does that even mean?
We're getting ready to open a new patient care floor at one of our off-site locations here. And all of our training for that entire facility now has been done with interprofessional teams in sim centers and places where they're learning together.
I wouldn't start anything unless we have a plan of if we're going to continue or not.
You have to change the culture of the whole unit. And the only way to do that is to have everyone working together, each person feeling valued in their contributions, and then respecting what everyone's input is so that they feel like they could speak up when necessary.
We've been able to improve outcomes by implementing programs such as therapeutic hypothermia, where we cool them. And that takes pharmacy, physicians, nursing, all at the table to figure out exactly how to get that done. Other things such as proning people, putting them on their abdomens when they're severely hypoxic or need more oxygen. And we know those therapies improve quality, they improve patient outcomes, and no one discipline could do that in a vacuum.
Fundamentally, it meant getting people out of the private office and into these pods or shared workspaces. But our model is to have 8 seats in a pod. It takes people about a day to realize it is a far more interesting, socially stimulating, lively, rewarding way to spend your professional days than being isolated. And I think that's a big piece of what really puts a lot of that vitality back in primary care, particularly in our setting.
We've created an environment where people can have conversations that are content driven, where there are specialists within the pod, within that hallway of pods. And they've got the right actionable data, and they can go and get that consult. Our platform allows for our medical, dental, behavioral health all to share the same record on the patients.
The dashboard will read the medical visit schedule. It will show to the behavioral health provider who the medical provider is that's saying, and it will interface with the problem list on the health record and look for possible behavioral health diagnosis and alert the behavioral health team, hey, there is a patient in medical today that might benefit from care from you.
The CNO-CMO Alliance is all of the CMOs and associate CMOs from the Penn Health System, so the different entities in the health system, as well as the CNOs from those organizations as well. And the agenda is determined collaboratively, what we'd like to discuss, what we'd like to get behind as a CNO-CMO team.
We've brought in the medical director from hospice. We brought in the medical director and the chief nurse from our rehabilitation hospital, from home care. We work together and really rally around themes that we come to by consensus.
For example, a few years ago, the CNO-CMO Alliance got behind developing a palliative care service, which has been incredibly successful.
We adopted it as our sort of cause for the budget process for that year, worked with finance on it, and have built it out now over 4 years to a really exceptional program.
Do we always agree? No.
No.
But it's having those conversations, right, of trying to get the other's perspective of, why are you thinking the way you are, and would this, help make the situation better or worse?
Probably the most important thing we can do, though, is to model that behavior for the other people that work within the organization, especially as you go down into your really important leaders, which are the ones that are right at the front line.
We meet regularly, we talk quite frequently, and I think it's just an open dialogue that really is helpful. I would also add to that respect. We respect each other as far as our profession and where we are as experts, and bringing those together to create a team is what works for us to deliver that care.
Again, it's not just nursing trying to take care of the families and the patients. It's a joint effort, and we need to make sure that we understand one another and then be able to support one another.
Virginia Mason Health System visually and operationally puts the patient at the top of the pyramid that summarizes its strategic goals. Healthcare providers understand that putting patients and families first may be the most important way to enable interprofessional collaboration. That interprofessional collaboration improves patient and provider satisfaction, creates a safer environment, and enhances the quality of care.
When you're able to harness that with the patient and family's wishes, then you're going to come up with the best outcomes.
We changed the gap for cystic fibrosis, going from a 16% gap down to a 4%. We were able to go up to 244 days without having to give glucagon. We did great improvement work in the community as also, looking at 80% from a 5%. And then we really raised the care internally, going from 75% to 95%.
And it doesn't cost them millions and millions of dollars. In fact, in the end, it is saving them money because people are working well together.
Working well together and living well together. At Community Health Center, an appointment with a healthcare provider may include a walk up the street to the farmer's market to see how the market feeds a community with fresh fruit and produce, helping people lead healthier lives. The market also connects people to each other and to the community. One becomes stronger through the other.
COVID-19 infection control and modes of transmission. The situation involving the COVID-19 pandemic continues to evolve. There is recent evidence suggesting that the potential for the coronavirus transmission is through droplets and perhaps fecal shed. This is an important discovery for GI professionals, as the virus may be present in GI secretions and viral RNA is detectable in stool. Gastroenterology infection and potential fecal-oral transmissions must be considered. Personal protective equipment is used every day by healthcare professionals. Healthcare professionals use PPE to protect themselves, patients, and others when providing care. Now I'm going to provide an example of PPE. professional for potentially infectious patients, materials, toxic medications, and other potentially dangerous substances that are used in the healthcare delivery. In GI, we treat all patients as if they have the coronavirus. In the absence of accurate and reliable testing for COVID-19 infection and the prolonged asymptomatic shedding that precedes symptoms, all patients should be considered a risk. GI departments are now recommended to boost PPE for endoscopic procedures. All healthcare workers should use N95s or N99 or PAPR masks instead of surgical masks, and double glove instead of single gloves are part of personal protective equipment, regardless of the COVID-19 status. There is strong evidence to support this recommendation for upper GI procedures and lower GI procedures, i.e. the colonoscopy. Also, if negative pressure rooms are available, the recommendation is that you do use those.
Types of PPE we use in the GI clinic.
Are you ready? Okay. So this is April, and she is my coworker, and she's going to demonstrate how to put on the PAPR mask. PAPR masks are a battery-powered blower that provides airflow through a filter to the hood or face piece. It's reusable, and it can be used on anybody, even men with beards, who cannot wear the N95. Okay. So thank you, April. We use PAPR masks for every procedure. Does time really matter? Endoscopies can generate aerolized viral particles that can stay visible for up to 3 hours, depending on the airflow dynamics. Furthermore, viral particles can stay viable, for 72 hours on plastic surfaces and can easily promote the spread of the COVID-19 virus. And like I said before, it can also be shed in the stool. Now, having that information, it is very important to properly clean the room. That requires that you wait a certain amount of time for the particles to settle. Individuals performing endoscopies are at higher risk for developing the infection. Once the procedure is completed, extra time is determined by your facility. At our facility, 30 minutes has been deemed the time in which you can enter the room to clean it. Again, like I said, if there's a negative pressure room, that will change the amount of time that you can go in there. COVID-19 PPE donning on. First step, hand hygiene. Second step, N95. Step gown. Face shield. Last step, gloves. The American Gastroenterology Associates has now issued recommendations to mitigate risk to endoscopy personnel based on a systematic review of the literature.